In the United States, hypertension is actually considered the most commonly diagnosed problem. Recently, the criteria to meet hypertension was changed. So before, having high blood pressure was considered anytime you had a consistent systolic of 140/90, but now it has been changed to 130/80. So anything above that is considered hypertension now. Hypertension is actually prevalent among people who have diabetes and those who are of African American descent. It is believed that anybody who is in the pre-hypertensive category is high risk of developing this condition in the future. There are a couple of categories of hypertension. One of them is isolated systolic hypertension, which is when your diastolic rate is normal, but the systolic is consistently elevated. In primary or essential hypertension, it is caused by a combination of genetic or environmental factors such as diet, exercise, smoking, gene expression, or psychosocial stressors. Secondary hypertension is associated with an underlying medical condition like chronic kidney disease. And then there is hormonal hypertension, which is caused by an imbalance of hormones that commonly involve the pituitary or the adrenal gland. This can be caused due to Cushing syndrome or pheochromocytoma. So the pathophysiology of hypertension is caused when there is an increase in total peripheral vascular resistance or an increase in cardiac output or both. So prolonged smooth muscle constriction can cause structural changes that ultimately lead to irreversible thickening of the arterial vessels, and that leads to irreversible increases in peripheral vascular resistance, ultimately leading to hypertension. In the renin-angiotensin system, renin is responsible for converting angiotensinogen to angiotensin 1, which then becomes converted into angiotensin 2 in the lungs by the angiotensin converting enzyme. And then angiotensin 2 is actually a potent vasoconstrictor that stimulates the release of aldosterone, which ultimately increases blood pressure by increasing water and sodium retention in the body. There's a lot of symptoms that the patient can present with. Unfortunately, some people may not experience any symptoms at all, which is why this disease is considered to be a silent killer. Other people can experience impaired vision, edema, severe headaches, fatigue, confusion, chest pain, difficulty breathing, irregular heartbeat, or a pounding sensation of the head, neck, or ears.